Hi, in this video, let's look at painful sex and when you should never ignore this problem. First, I'll talk about the structure of the vagina. Next, I'll look at 10 different conditions when you could experience pain during sexual intercourse and which you should definitely speak to your doctor about. Let's get started. Hi guys, welcome back to the channel. I'm Dr. Sylvia, a general practitioner and health educator, and this is AskAwayHealth, where we provide you with clarity and direction about everything medical. If this is the first time you're coming across one of my videos, welcome. I hope you choose to subscribe to the channel, and don't forget to click the notification bell so that every time we publish a video, which is usually once a week on Saturdays, you'll get to know about it. Normal sexual activity is generally not painful, so if it does become painful, there must be a reason. If it's something that's happening quite frequently or regularly, if it's very uncomfortable and bothering you in any way, that's the time to talk to your doctor about it. In some cases, when painful or slightly uncomfortable sex happens, it could easily be explained and you may not even require medical attention. So first of all, I'll talk about some of the situations when that could happen, and then afterwards those that you shouldn't ignore. But first, let's get some parameters sorted. In this video, I'll be describing and discussing issues around vaginal intercourse. And what we should know is that painful vaginal sex could happen in different ways. First, it could affect a woman who's been having regular sexual intercourse and suddenly she starts to have pain around sex. The second instance is when a woman has always associated vaginal sex or penetration, for example with a tampon or during a vaginal examination, with pain. Another way of classifying painful sex is from the type of pain that you may experience. Is it at the beginning when there is pain only at entry of the penis or at the start of penetration? Or is it experiencing deep pain during thrusting movement by your partner? For some women, some pain also happens during any form of penetration when trying to insert a tampon or during a routine vaginal examination, either with the fingers or using what's called a speculum to examine the vagina. Another type of pain that one might experience includes a burning pain or aching down below after intercourse, a throbbing pain, or pain that just carries on for several hours after intercourse has happened. Okay, so now let's talk a little bit about the vagina. The vagina is a hollow muscular tube. The vagina begins at the vulva, which is that part of your body right at the top between your thighs. So your vulva is the space in between fleshy tissues known as your labia, and in that space the opening for the vagina as well as the opening for your urethra, that is your urinary tube, are found. Now from that opening in the vulva, your vagina travels upwards until it gets to the first part of the womb called the cervix, and that is where the vagina ends. Now let's look at some parts of your vagina that could be relevant to this discussion. First, let's talk about the hymen. A woman's hymen is a thin fleshy tissue that partly surrounds the opening of the vagina. The hymen sometimes can break when a woman first has penetrative sexual intercourse, and this is why breaking of the hymen has often been linked to loss of virginity. But there are many other ways where the hymen can break in the absence of sexual intercourse. Examples are with vigorous sporting or athletic activity like running or horse riding and using a tampon. Therefore, losing the hymen is not strictly related to a loss of one's virginity. Now, a woman who has never had penetrative vaginal sex may have lost her hymen without even realizing it, because in some cases losing the hymen does not happen with any pain or with bleeding. Another thing to note about the vagina, because if you remember I said it's muscular and therefore it's able to stretch to accommodate the size of a penis or the head of the baby and the body of the baby during its passage through the birth canal in labor. Okay, so let's look at another aspect of the vagina, and I'm talking about Bartholin's glands. Bartholin's glands are two pea-sized or peanut-sized glands that you find just behind and to either side of the labia. That is those fleshy structures that surround the opening of the vagina. Now the glands are usually not noticeable because they are less than 1 centimeter across. But they're really important because they produce a liquid or fluid that acts as a lubricant during sex. So the liquid produced by the Bartholin's glands travel down tiny ducts into the vagina to provide lubrication during sexual intercourse. So that's a little bit about the structure of the vagina and the different aspects of how it works that I think might be relevant to our discussion. So let's get back into it. What are the causes of painful sex? Okay, for those who are interested, painful sex is also known as dyspareunia. Number 1, there can be pain during the first ever penetrative sexual intercourse simply because of friction between the penis and the vagina. Of course, this pain is minimal if sex is consensual and if the woman is relaxed, because it also implies that she will be aroused, so the vagina is well lubricated and any discomfort that she might experience will not be long lasting. Number 2, what about sex during pregnancy? Now this is another natural cause of painful sex. Sex during pregnancy is safe, but it can be uncomfortable for some reasons, primarily because of the different stages or different hormones that are circulating in your body when you're pregnant. So as a result of these hormone changes, the vagina tissue itself could be dry, it could be swollen, all of which can make sex more uncomfortable. But in addition to this, as the womb grows bigger, finding a position that's comfortable for sex is a little bit more difficult, and so you have to explore and see what works best for you. Number 3, breastfeeding is another natural event during which sex can be painful or uncomfortable. The reason again is down to hormone levels, because during this time your levels of estrogen, which is what generally maintains the health of tissues in the vagina, is reduced, and so the low estrogen levels make the vaginal tissue dry and thin, and it's more comfortable to have sex. Number 4, childbirth is another situation that may lead to painful sexual experiences. This can happen following a procedure like an episiotomy, which is when a woman sustains a cut to the area between her vagina and the anus, also called the perineum, during vaginal delivery in an effort to widen the birth canal for the baby to come through easily. And the same thing might happen if you didn't get a cut but sustained a tear during the same process. In both cases, you might require stitches, and until they're fully healed and for some time after, it might be uncomfortable to have sex. And number 5, another time that sex can get painful is during or around the menopause. The menopause is the period around which a woman stops releasing eggs from the ovary. At the same time, estrogen levels also begin to reduce. And as I've explained before, the effect of estrogen, particularly on the vagina, is that it makes the vaginal tissue dry, thin, it narrows or tightens the vagina, so that having sex during that time with this combination of changes can be quite uncomfortable. Okay, so just to round up this segment, painful sex that's related to pregnancy or breastfeeding or childbirth will naturally resolve over time. So you don't need to have any specific treatment unless there are any signs of infection going on down below, which is something you would need to discuss with your doctor. Generally, all that may be required is just to be more adventurous with different sexual positions that may be more comfortable, and the use of safe vaginal lubricants. For vaginal dryness that happens during the time of the menopause, the options are the use of lubricants or hormone replacement therapy, simple vaginal estrogen cream or gels that can make the vagina a lot less dry and improve the sexual experience. Okay guys, thank you for sticking with me to this point. I just have one question for you. Let me know what you think in the comments below. Outside of natural causes like the ones that I've discussed above, what do you think is the most common cause a woman might experience painful sex? Love to hear from you. I'm looking forward to reading your comments. Right, so let's look at these situations outside of natural causes where sex can be painful and what we should be thinking when that happens. Number one, when there is rough or violent sexual activity. If sex is not consensual, that is, if it is by force, in the case of a sexual assault, attack, or rape, sex can be painful with injury to the vagina from forceful penetration. On the other hand, vigorous sexual activity, when it's consensual, that is, both parties have consented to having sex, can also cause damage to the vagina, whether it's from your partner's member, the penis, or from using sex toys violently pushed into the vaginal canal. Number two, female circumcision or female genital mutilation can cause serious injury to the vagina that causes painful sex. Number three, in a situation where there is lack of foreplay before penetration happens. Remember we talked about the Bartholin's glands, and remember what they do? They produce that fluid which lubricates the vagina during sexual intercourse. Well, if there isn't enough foreplay or you're not aroused, your Bartholin's glands do not produce the liquid, so the vagina is dry, and that can make sex painful. And number four, infections within the vagina or the rest of the reproductive tract. Now, the infections can be sexual or non-sexual. By sexual, I mean having sexually transmitted infections or sexually transmitted diseases. These can cause inflammation of the tissues within the vulva, the vagina, the cervix, and the rest of the womb. This inflammation leads to changes in the tissue, making it sore, which causes the pain that one can experience during sexual intercourse. Now, there are several different types of germs associated with sexually transmitted diseases, and they can also occur with other symptoms. For example, a bloody discharge from the vagina, itching, as well as painful sexual intercourse. Some of these infections may occur with less pain than the others, and some others may even be asymptomatic, so they do not cause any pain, whether during or outside of sexual intercourse. For non-sexual infections, we consider common problems like vaginal thrush infection or a urinary tract infection. Heavy infection with thrush, that is candida, can cause severe itching in the vaginal and vulval tissues, as well as swelling to those tissues, which can make sex very uncomfortable. Similarly, an infection of a woman's urinary tract can leave the urethra and the surrounding tissues very sore and inflamed, which could affect the vaginal tissue. The opening is right beside the urethra, and again that could lead to a lot of pain during sexual intercourse. Another part of the vagina that could be infected and lead to real problems is the infection of the Bartholin's glands or cysts within the Bartholin's glands, leading one to experience a severe lump behind that area that is called a Bartholin's abscess. That's very painful and can be associated with painful sexual intercourse. That needs to be treated with antibiotics and draining the abscess out of the area. Number 5, skin conditions. So we've seen how dry skin or tissue in the vagina can affect or be affected by sex. But apart from hormone changes that happen with the menopause or with pregnancy or breastfeeding, there are skin conditions, for example, eczema, or for people who have very sensitive skin, which could make sex a painful experience because they could lead to developing ulcers, cracks or tears along the tissue of the vagina, and people who experience those have itching and burning sensation, which makes sex a whole lot more uncomfortable. Number 6, and people may not really think about this too often, it's medicines, drugs, the treatments that you may be on for some other problem. Some of these medicines may cause dryness in the vagina and be responsible for painful sex. The most common examples that we know cause these problems are some types of birth control or contraceptive pills. We know that some antidepressants, that is drugs used to treat depression, could also affect the vaginal tissue in this way. Other examples are sedatives or sleeping medicines, some cold remedies, and anti-allergy medicines that contain antihistamines, as well as some medicines used to treat high blood pressure. In addition to this list could also be some medicines used for treating cancer, that is chemotherapy. These can all contribute to some degree of dryness in the vagina and could make sex painful as a result. Number 7 is a condition known as vaginismus. Remember we talked about the vagina, its structure being a muscular tube? Well, when for some reason or the other the muscles of the vagina spasm involuntarily, so that's without anyone triggering or controlling how they're acting, this is called vaginismus. Vaginismus can make sex very painful. We think that there could be some psychological or emotional factors associated with developing vaginismus, but we must bear it in mind when considering the possible reasons a woman is experiencing painful sexual intercourse. Number 8, congenital problems are problems that happen right from birth. And congenital conditions that may lead to painful sex are if, for example, the vagina is not fully formed, or if the hymen, which we referred to earlier, is fully covering the opening to the vagina, because both of these can lead to painful sexual intercourse. Number 9, a whole host of medical conditions could cause a woman to experience uncomfortable or painful sex. Some examples: diabetes mellitus, where there's excess or high blood sugar, and Sjogren's syndrome, which is an autoimmune disease affecting types of tissue in your body, can both lead to dryness in the vagina and painful sex. Other conditions that can also affect painful sex are irritable bowel syndrome and hemorrhoids or piles. The symptoms of irritable bowel syndrome can include bloating, frequent changes of bowel movements, and of course, considering the close location of the bowel to the pelvic organs and the womb, it might cause pain during sexual intercourse. Similarly, having very swollen or painful piles can also increase a woman's discomfort during sexual activity. Okay, what about diseases that affect the reproductive tract itself specifically? They can also cause painful sex. Examples are endometriosis, where tissues of the womb occur in other parts of the body outside of the womb. And if you're interested in learning more about endometriosis, I'm going to put a link in the description box below where I have a whole playlist series on endometriosis, its causes and different treatments available. And another condition that affects the womb is called adenomyosis. In adenomyosis, the tissue from the inner lining of the womb now begins to form inside the muscle layer. So that this means during the monthly period, this tissue bleeds inside the muscle and can cause a bulky, painful uterus. It can also be associated with pain during sex. And what about pelvic inflammatory disease? This is an infection of the upper reproductive tract. So we're talking about the body of the womb, the fallopian tube and ovaries. We think it most commonly happens following sexually transmitted infections affecting the lower part of the womb that tracks upwards, and that can cause very painful sexual intercourse. A few more conditions, and these are related to the structure of the womb itself. One of them is called a womb prolapse, and a womb prolapse is when part of the womb juts or drops down into the vagina. It happens because the pelvic floor is weak. The pelvic floor is a sheet of muscle which is holding the different organs within your pelvis, namely your womb, the bladder and your rectum and anus in place. And if the pelvic floor is weak, perhaps from having surgery to the area or from multiple pregnancies, it can result in prolapse. So having sex with a womb prolapse can cause a lot of pain. Now, if you have what's called a retroverted uterus, and that's a condition that happens in up to 20% of women, it's also known as a tipped womb or uterus, a tilted womb or backward womb, and this condition may cause you to have painful sex. For most women, the anteverted uterus is pointing forwards, while in the backward uterus, it's pointing backwards. So each time your partner penetrates or thrusts and hits the uterus, that could cause pain. Having uterine fibroids can also be a cause of painful sexual intercourse, particularly if the fibroids are located very low down in the womb or within the cervix. And lastly, ovarian cysts, which is when cysts develop in either of the woman's ovaries. They can get very large and they can get infected, could contribute to painful sex. And if you're interested in learning more about ovarian cysts, what they are and how they form, make sure you check out this video I've done on ovarian cysts. I'm going to put a link in the description box below, and I hope you find it useful. So number 10, a significant and really important factor when you're considering the possible causes of painful sex is emotions. Our emotions are deeply related to sexual function. Psychological issues like anxiety or depression, your self-image or self-perception, a fear of intimacy or other relationship problems can contribute to a low level of arousal, and that will lead to discomfort or pain. And what about stress? Did you realize that your pelvic floor tends to tighten in response to stress in your life? This alone can contribute to having pain during sexual intercourse. And not everyone who has suffered from sexual abuse complains of dyspareunia or experiences painful sex. But if you have been abused, it can play a role. So those are 10 reasons that you might experience painful sex. And more commonly, painful sex on entry tends to be associated with lack of lubrication, experiencing trauma or injury to the vagina, using certain drugs, a vaginal infection or skin disorder, vaginismus, or a congenital vaginal disorder. On the other hand, causes of painful sex on deep penetration are more likely to be due to conditions that affect the womb, such as endometriosis or fibroids, or scars from previous surgery like having had a hysterectomy, that is removal of the womb, or cancer treatments like radio or chemotherapy. So like I said at the beginning, in a lot of cases, painful sex happens for natural reasons, and simply understanding them helps you realize which ones may require treatment or not. But in other cases, it's essential to find out what the cause is so it can be immediately addressed and treated. Guys, thank you so much for watching. Do let me know if you found this video helpful, and if you have, please like and share with your friends. I've got a ton of other videos on the channel, and you might want to just check them out in the playlist for similar topics. And listen, if you'd like me to cover similar topics or other topics you'd like to suggest, let me know in the comment section below, and I'm certainly happy to consider it. Thank you for watching. Don't forget to subscribe and click the notification bell. Stay well, and I'll see you again soon.